Thank you for having me today, and I'm so glad to be here. I'm a fifth-year medical student from Khon University, and it is my study named Parental Attitude and Practice regarding atopic dermatitis. It's a cross-sectional study among a type population, and yeah, atopic dermatitis is a chronic inflammatory skin condition characterized by itching, inflamed skin that flare up, fill-ups, and persists over time, and patient may it may be commonly occur in childhood and it may last into adulthood. And patient may face several disadvantage and challenge in their everyday lives. And existing research showed me that effective control of atopic dermatitis rely on parents' attitude, practice, and their knowledge of the disease. And however, there is a lack of literature addressing parental knowledge, attitude, and practice in particularly Thailand. So we decided to conduct this research in the Thai context. And my study aimed to investigate parental attitude, practice, and behavior toward atopic dermatitis in parents that divide into two groups. It's a cross-sectional study via Google Form, and we divide parents into two groups. The first group was parents with children with diagnosis of atopic dermatitis, and the another group was parents with no children with diagnosis of atopic dermatitis. And this is the result, the table 1 showing as the demographic data, and the table 2 showing as common practice. Oh, sorry, the table 2 showing as attitude and perception, and the last table showing as common practice. Let's talk about the table 3. The key finding that we got from this table was parents with children with diagnosis of atopic dermatitis were better knowledgeable than parents with no children with diagnosis of atopic dermatitis, because parents with children with diagnosis of atopic dermatitis select more causes of atopic dermatitis and bigger factors that they perceive to be a worsening cause of atopic dermatitis than parents with no children with diagnosis of atopic dermatitis. So we can assume that parents with children with diagnosis of atopic dermatitis were more knowledgeable than another groups. Let's move to the table 3 showing as common practice. The key finding from this table that I've got was the common practice between these two groups of parents were the same, as you can see the p-value. And I also got the interesting features from this table as well that I've star. The first thing that the majority of the parents say yes for maternal food avoidance during lactation and breastfeeding for like almost 60%. And they also say yes for food avoidance in a child immediately when suspect food avoidance without a confirmation test for like 41.9%. So it means that a lot of parents have misunderstanding about the way to prevent atopic dermatitis. So let's discuss about the finding that we got from our study. The first thing, parents with children with diagnosis of atopic dermatitis were better knowledgeable than parents with no children with diagnosis with atopic dermatitis, and the common practice were the same. And majority of the parents concerned about food allergy, so they decide to do food avoidance in advance in their children and even in the mother during lactation and breastfeeding. So the bottom line of my study was there is some misunderstanding and inadequate knowledge of the parents regarding atopic dermatitis prevention and treatment. And we should educate and provide information that parents shouldn't do food avoidance in a child in advance because because food avoidance may lead to malnutrition to the child or even in a mother. So it's kind of like an adverse effect that we don't want to let it happen to our child. And we can provide the information that we have topical corticosteroid, we have moisturizer, and we have medication to apply for skin lesion. So we shouldn't do food avoidance to prevent atopic dermatitis. So this is the key finding and main idea that I got from my research. Thank you for your kind attention.
Thank you very much for the presentation. I'm just wondering how many parents did you go for an interview and what method of interview you use? Like you send to the group line or like the pool of the participants and the response rate?
Oh, we include 372 parents in dermatology clinic in Senior Clinic Hospital, And we use the method of consecutive convenience cases to and invite them to complete the questionnaire we're going to form. But I'm so sorry that I can answer your response late because I don't sure for that.
So you get like 372 samples,
Yes.
but like how many? Like you send it to like 500 people or 1,000 people?
I don't sure about the response list.
Okay. All right. I have another question. You mentioned that like the furry toys, the furry pets are like the most common allergic agent, right? This is from the parents' viewpoint. Is that correct?
Yes, only parents.
And this is also the parents' viewpoint that the food should be avoided when they have like allergy, when the kids have allergy. Right?
When they suspect that the children might have food allergy without any confirmation test. My intention is the children might not have like allergy.
It's a bit strange to me because this information may come from different families because you don't have the confirmed diagnosis, and this is the guess of like the viewpoint, the perspective of the parents that the furry toys, the furry pets is the cause, and the other families may think that food avoidance is the best way because their kids have food allergy, which may be correct.
Mm.
So how would you match? I'm wondering about how you match like the furry pet from like one group to the other food avoidance as a cause to the other group as like the misunderstanding of the parents. Do you have any idea about this?
It's just a survey. So like
I appreciate the point that like the furry pets and furry toys are like the most commonly perceived agent that the children may have like atopic dermatitis the most. So